Recovering from joint replacement surgery, it can be a grueling process. Tulsa doctors at an outpatient surgery center can now use a robotic procedure that can predict a person's recovery process. News on 6's Caitlin Deggs explains why that information is important for patients.
With the Mako SmartRobotics system, surgeons like Dr. Scott Reed can better see how surgeries like a knee replacement will impact the entire body.
What the Mako allows us to do, the way I explain it to my patients, is it allows us to know the consequences of the bony cuts we're going to make before we actually make them.
This data can help surgeons decide the best course of action for each patient, because everyone doesn't react the same way, especially in situations where the result can be hard to predict.
The problem with soft tissue releases is that they're not very predictable. And so you may think when you're in the operating room that you've balanced the knee really well. Ultimately, that may not actually be the case.
Finding potential problems earlier can change the recovery process and the lives of patients.
One outlier, if we have one patient out of 100 that has a poor outcome because we didn't get the implants in exactly the way they needed to be, that's a big burden to that patient, and we want to try to eliminate those as much as possible. But B, there's a big cost to the system.
Reed says this technology has been in hospitals for nearly a decade, but being able to have the Mako at Tulsa Bone and Joint Surgery Center can benefit more patients.
Now I think we've got every insurance contract that we have, to include Medicare and all the other subsidiaries of Medicare, we have the technology available to them now.
And he's excited about the future of this technology and the number of people it can help in the future.
If we can use this technology to provide a more consistent outcome to our patients, ultimately that's what we're looking for.
Caitlin Deggs, Oklahoma's Own, News on 6.